Good afternoon, everybody. Welcome to the Community Planning Partnership Board. Today, the 4th of December. I'm Marcely Craig and I am Interim Chair of NHS Dumfries and Galloway and co-chairing this board as a result. It's great to see everybody here and online. Could I remind everybody that we're being live streamed today to allow for public access, and also that this meeting is being recorded and will be available for subsequent viewing online. We are due to finish by 4:15. Can I also advise you that we're slightly rejigging the agenda today due to presenters' availability, so we'll be swapping agenda items 5 and 6. Stephen, could I please ask you to give a position about attendance? Thank you.
Thank you, Chair. We have apologies for Joanna Campbell and Karen Hunter as substitute today. Jane Morrison-Ross and Russell Griggs as a substitute. Shona Mitchell and Andrea Hall as substitute. Alex Lamb and Joanne Threlkeld as a substitute. And apologies from John Campbell, John Dugan, and we were advised that Joe Cochrane's will be joining online but might be slightly late. Thank you.
Thank you very much, Stephen. If we move on to item 1, please, the draft minute of the meeting of the 13th of September. Are members happy that this is an accurate record? And does anyone have any comments or queries? I don't see any hands. I just wanted to make one note or comment, if you like. At 7.4, where we discuss the additional support needs school transitions project, I'm happy to report that since we last met, the NHS now has capacity in place to support engaging with employers and employment support in that space. So just to note for members. Thank you very much. Okay, if we move on to item 2, the Community Planning Action Log. Stephen, can you update us, please?
Yep, thanks, Chair. Just a few items to bring to everyone's attention. So discussions around child poverty and the coordination prioritisation are still ongoing behind the scenes, but we've obviously got the Child Poverty Action Report to look at. It's the last item on the agenda today. The other couple of updates in terms of children's rights and requests made at the previous meeting, and also tobacco and vaping are at item 3 on the agenda today, so we can cover those at that point.
Thank you very much. Any comments or queries from anybody? Thank you. Okay, if we move on to item 3, the Loip and Community Planning Update Report. I think Stephen and Valerie are going to speak to this report. I'll hand over to you both. Thank you.
Okay, thank you. So there's various sections covered in the report, so if we can just maybe move through them one by one, that would probably be the best way to approach it. The first one was to bring to board members' attention the ministerial visit which took place on the 1st of November, and that covered quite a lot of community planning content in there. But the NHS led that through Valerie, so I think Valerie's going to provide a brief update. Thank you.
Thanks, Stephen. Thanks, Chair. Yeah, I think it was a really positive visit that we had with the Minister for Public Health and COSLA Health and Wellbeing spokesperson. I think it was really great to demonstrate a real partnership approach in Dumfries and Galloway, not just statutory partners, but also our third sector partners as well. So it was really great to showcase that. We've not yet had a formal letter of feedback from the visit, but I anticipate that will be coming in due course. But it was a really great opportunity to showcase our work that we're doing, particularly anchor organisation development, community transport work, which Alan is leading on, and to also showcase the 3 Young Eyes video, which our young people have developed, and was really, really well, highly praised at the visit as well. And understand they've also been invited to Parliament to present on that as well. We also had a presentation from our Active Lives Partnership, which is a strong partnership between the Council and the NHS to promote physical activity for those not meeting physical activity guidelines, and then a visit to see actually an Easy Obics class in action, which was really a joy to see as well. I think the day was kind of finished off on a real high by seeing the work that's going on in Summerhill Community Centre, and that was a really, really fantastic opportunity to showcase the fantastic grassroots community-led work that happens. And the quote that was issued was really that was public health in action. So a really worthwhile day, and I'm really grateful to all the community planning partners that were involved and that attended and supported that event on that day. So thank you.
Thank you, Val. I was lucky enough to be part of that visit, and I think Councillor Johnston was there as well. And it was a really interesting and exciting day, actually, seeing public health in action. Thank you. Stephen.
Okay, thank you. So the second section is really a follow-up on the UNCRC discussions from the previous meeting. So I've been in contact with one of the managers from Children in Scotland in terms of arranging the training for board members. So we're looking to schedule that in the first part of 2025. Third Sector Dumfries and Galloway have also offered the assistance of their lead for children, young people and families to help shape that session, and the content will develop through the senior leadership team. On page 19, there was a request for additional information on the rights respecting school awards and how that was being promoted. So the Children's Services Manager has provided significant detail there, and has also advised that there's new events are going to be targeting parents and carers within 2025 to help raise awareness. And the new Children's Services webpage has also just recently been launched, so lots of very useful links and information contained on there. Thank you.
Thank you, Stephen, and thank you for the additional information that was requested. I think we're happy to note that, unless there are any hands up, and I don't see any. Thank you.
So at section 3.1.2.2, tobacco vaping update, and this is one of the key discussion items or agreements that we're asking for board members today. So at the last meeting as well, we were asking for clarification from the Council's Community Protection Manager in terms of what powers trading standards have. And as you can see, that's contained there. Of interest, you will see that over the last few months, there's been 2 separate seizures of 270 illegal vapes and 117 non-compliant vapes. So work is ongoing to check in with premises regarding this, and the services are looking at ways they can increase their capacity to undertake more spot checks. So what we have in Appendix 1, and Valerie's taken a lead on this with the Youth Council, there was 2 asks from the previous meeting, and that's that the board developed a joint statement with the Youth Council that would go out as a public press release, and secondly, a letter to both UK and Scottish governments for approval as well. So I'm just going to hand over to Valerie now, who's been leading on the detail.
Thanks, Stephen. So as Stephen's outlined, it was requested that we, community planning partners, would put a joint letter to the UK and Scottish Government. So we've provided that letter based on the paper provided last time for approval, and also that there was a joint, a consensus statement put out by community planning in terms of our stance in tobacco and vaping for children and young people. I think there was very strong views from the Youth Council that we heard at that meeting about them wanting to be protected from this. And I'm glad to say that the Youth Council have agreed to support both the letter and co-sign it, and the joint statement as well. When we discussed this at Community Planning Senior Leadership Team, Alan Webb very kindly suggested we contact Ash Scotland, which I did do, and I'm pleased to say that Ash Scotland are supportive of community planning, taking quite a strong stance on this action, and would be happy also to support any press release that we issue as well, and add a quote into that too. So I'm just really looking for the board to approve the letters and the joint statement for issue as a press release. Thanks.
Thank you, Val. Given that we've got a number of colleagues online, can I suggest that if you don't agree with the press release and the letter, that you raise your hand, Otherwise, I would presume that we're agreeing the contents of both of those. I don't see any hands, so I'm happy. Yep, I think we're agreeing, Val. Thank you.
Okay, the next section is the LOIP action plan, which partners have been working on behind the scenes. So it's fair to say that there's been progress across all the actions, but some are further forward than others, and some there's been capacity issues in some areas due to staff pressures, competing pressures, etc. So the senior leadership team are meeting in January to look at each of the actions and just review the original timescales to check if they're going to be on track or may need a couple of other months to complete that. So just looking at Appendix 2. Okay, and the first one on community wealth building, and SOS have been taking a lead on that. So there's invites out for workshops which are going to take place, as you see in the paper. There's 5 workshops covering all 5 pillars of community wealth building, and they're going to be built in for the first quarter of 2025. And there's already a range of information that's been gathered in terms of examples that would contribute to what does community wealth building look like within Dumfries and Galloway, and to build that picture up. So that project is on target. Valerie has been leading the anchor organisation work, which every community planning partner has actively participated in. So I'll just pass over to yourself, Valerie, for an update on that one.
Yep, thanks, Stephen. Yeah, we had a really successful second meeting just at the beginning of November, where all our community planning partners had taken away the Public Health Scotland anchor benchmarking framework and actively looked to complete that and fill that in. And we came together to share our learning in respect of that. I think there was some key learning points for each of us. I think what it did was it helped get a common understanding of actually what do we mean by anchor organisation and what are some practical and tangible examples of that. And I think all partners were actually quite reassured that they do a lot of work in that space. It's just maybe not badged as that, but I think everybody found it really positive in terms of there's things that we could do to improve and really further develop our anchor organisation status. I think we recognise it was a bit more challenging for our national organisations to undertake due to the structures, but nonetheless they had done that, and I think they could then actually see where is there opportunities that we could try and do local work, and there was examples of local work even within those national structures as well. So the next steps are just really to kind of pull together those kind of key learning points, look at is there areas that we want to collaborate on. There were certainly some organisations who are really strong at certain aspects, so council in terms of asset transfers, which is an NHS, is somewhere that we would be keen to kind of learn from. So is there areas that we want to collaborate further on to take that forward? So we're going to meet again in early January and just agree any next steps, but I think what we'll need to be really cognisant of is that we don't kind of cross over into the territory that SOS are leading in terms of community wealth building, and that we have probably an end point to this project, and any other further actions we look to bring back here for agreement. I think probably also just to highlight that we were invited, I was invited to present on this project at the Public Health Scotland Anchor Peer Learning Network as well, because it was real interest in actually that approach that we took as a community planning partnership to do that. So other areas want to learn, so I'll be presenting on that on the 11th of December. So nice to be able to showcase good work in D&G in that national arena. Thank you.
Okay, thank you. The next two are both amber at the moment. We do have some information, really good return from the NHS in terms of climate and how they approach that, and their format is really, really useful. So I'm picking that up with the lead officer early in the new year.
Can I just come in on that, Stephen?
Yeah.
It's an offer, I suppose. On behalf of the NHS board, I chair our Net Zero Programme board. So if it would be useful to do some cross work in that space around climate emergency, I'm very happy to pick that up outside. Thank you.
No, thank you, Chair. That's really, really helpful. Thank you. And the second one, we've got a revised template on reducing the D&G disability employment gap, which our Employability and Skills Manager has led on. So that's up for approval. It's a bit of a pilot piece of work. Would you like to consider that just now, or wait till we've gone through all the updates? Well, yeah, okay. Okay, and the next one is community transport. So Alan Webb's on the call, and hopefully Alan can come in just to give a bit of a more detailed update of how the project is progressing.
Good afternoon, all. Yes, so the community transport programme started earlier this year, as partners will remember. We now have our lead for community transport in place, and a really well established now Community Transport Strategic Development Group, which is the kind of new formation of the previous public social partnership. It includes all of our partners, some national bodies and local community transport providers. So far, really healthy conversations, not only just on the kind of community-led design of community transport, which is a key focus, and the development of a social enterprise, but we're also taking the opportunity to use that forum as a guest design mechanism for an integrated transport design structure for Dumfries and Galloway. So lots of conversations around bus networks, around public transport, around NHS and health transport all take place in that forum, I think, which is a really great place to do that. There's a development session being planned for early in 2025 to include all partners and providers about how we take forward an integrated model. And it is possible that in the original timelines we will be able to see the establishment of our social enterprise before the 3-year timescale that partners had agreed. However, the intention is still to continue the 3-year programme because it gives us an opportunity to use those resources to embed whatever future model we agree on. And there's an updated timeline coming to the next SLT for approval. So great progress overall. Thanks.
Thank you. So the next one is around digital, which myself and Alan have been working on. And again, we've got an updated template for consideration, which really takes into account some of the national developments. And you'll see in the appendix we've mentioned about the recent Audit Scotland report on tackling digital exclusion, which makes some recommendations for partners to consider. So we've integrated that into the updated template. Later on in the agenda as well, we've got SOS who are going to help present the delivery plan for the Regional Economic Partnership. And one of their actions is in terms of closing that digital gap and doing a bit of mapping around that. So we'll ensure that we'll tie in with that piece of work to make sure we're all aligned on it. The other piece is still taken forward. Third Sector Dumfries and Galloway undertook detailed research exercise 2 years ago. So there was a number of actions detailed within there that we're keen to integrate and prioritise as well. And I see Alan wants to come back in.
Thanks, Stephen. Thanks, Chair. I suppose I just wanted to take the opportunity that I think we've revisited the digital inclusion approach a number of times, certainly over the last year in terms of the deliverables. I just wanted to make board aware that essentially what's starting to happen, though, is we're starting to reduce down our ambitions for our plans on tackling digital exclusion based on the capacity we already have. I think the intention was in the publication of the Third Sector research report that was undertaken a couple of years ago that we would realise that those ambitions by investing in resources, and obviously in current circumstances we've not been able to do that. So whilst Stephen and I are working closely together to maximise what we have and to link up a lot of work streams to get the best from them, I think it's important for board to recognise that without dedicated resource, the original intention of what we would deliver in our ambitions for tackling digital exclusion won't be possible. So in approving and agreeing to the template that's provided today, I just wanted to make board members aware that that is not about delivering our original ambitions for the programme. It's simply about realigning some of the deliverables in line with the resource that we already have. Thanks, Chair.
Thank you, Alan. That's really helpful. There's obviously quite a number of risks for various strands of our work in that. And I'm sure that there'll be conversations happening offline to try to address that as much as possible. But that's helpful to understand. Thank you.
Thank you, Chair. So Project 5 is tobacco and vaping, and perhaps Valerie could give an update on the education programme.
Yes, this is the project that we also discussed last time. So this is a kind of co-produced piece of work between young people and our Quit Your Way services in terms of promotion of what are kind of the messages, how do people access, you know, if they want to stop vaping, what support is available for them. So that is being developed, and youth work services are being involved in that and reaching out to young people that we might not otherwise be able to engage with. So that's meant the timescales have slipped slightly on that piece of work. But Abby Robertson, who's our Quit Your Way lead, is working with youth services in relation to that, and that's hopefully a positive piece of work that will be taken forward over the next year. Thanks.
Thanks, Valerie. And Project 6 is the locality plan pilot, which is in Kirkconnell Keller Home, and you can see the update in the appendix. There's initial desktop review has been undertaken, engagement with local partners, and the plan is to engage the community in January 2025. So it's still on target at the moment, and that's you know, it's a genuine pilot to see how and if that model works. If it doesn't, then we can make amends to it later on before rolling it out to other areas. And then the final one is the review of plans and strategies, which we've been ongoing. We've mapped the main strategies to the LOIP outcomes. We've done a next level down assessment on the delivery plans, and we're now looking at the very specific performance indicators that are attached to each of those, and that'll help inform the new version of the LOIP end of year report for 24-25.
Thank you, Stephen. Before we move on to the updated templates, can I just ask if there are any comments or questions on any of those 7 projects? Dawn, thank you.
Thank you, Chair, and thank you, Stephen, for going through those. I note that the leadership team will be looking at some of the timescales in January around the individual projects. And it's just to say that from a council perspective, if the leadership team finds that there are, you know, concerns and challenges in terms of alignment of resource and capacity, then I hope that that's raised, you know, with myself and obviously through our representative at the leadership team. And then secondly, you know, there's good progress against an awful lot of the projects here, which is really good to see. And I'm just wondering whether the leadership team will look at the opportunity for stretch in terms of some of the future actions and looking at acceleration of activity that might then yield greater impact and outcome in relation to those key projects that are so important for our LOIP. Thank you.
Thanks very much. I think one of the things is having the LOIP action plan was a kind of slightly different way of doing things, because we have, you know, a lot of the work of the Community Planning Partnership Board is happens in our strategic partnerships and things. So the focused plan is kind of priorities that don't sit neatly within that structure, and there might be over the coming time, particularly when things come like the kind of new population health framework, that there might be areas that actually might not sit neatly within other partnerships that we might want to kind of put into that kind of focused plan to have a bit more focus and attention to them. So I guess it's like that evolving process of a new way of doing things and doing things differently, which as a senior leadership team, very happy to try new and different approaches to how we can collaborate and work together. Thanks.
Okay. Thank you, Chair. So,
Thanks, Chair. Thanks, colleagues, for the update on the action plan. My question is probably one for Alan in relation to the community transport work. As, again, like Dawn did, I absolutely welcome the progress that's been made in all of the actions, but really delighted, Alan, to hear the update in terms of community transport. My question around it, though, was whether or not there might be an opportunity linked to one of the big key strategic pieces of work that's been undertaken through the Integration Joint Board around the Right Care, Right Place work and the development of our community hubs across Dumfries and Galloway, and if there is an opportunity to maybe test it, because one of the key factors, I believe, that will influence the success of these community hubs as they're developed is the accessibility of those and people actually being able to get to them and be able to make use of the services as they are developed within these new, they're not new, but repurposed facilities. So I was just keen to understand, Alan, if those conversations had happened at all around community transport and if this development was linked into that kind of key, kind of strategic piece of work through the IJB, and perhaps we could use that as an opportunity to test out some of the thinking around those community transport models moving forward. Thanks.
Alan, do you want to respond?
Yeah, thank you, Chair. Thanks, Julie. Absolutely. At the last Community Transport Strategic Development Group, that's hard to get my tongue around, that was on the agenda given the IGB's decision to create the community hub. So it's now on the agenda of the development group around how local needs are met based on the services that will be available in those hubs and how transport can be designed around it. So absolutely, it's now on the agenda. We have already identified some of those discussions, and essentially it helps some of the discussions because the challenges at the moment we have of transport is travelling from one end of Dumfries and Galloway and the other sometimes to access the services. Now we have a real opportunity to design services around the community based in localities, and therefore some of those solutions about moving around in the local spaces become much more aligned to community transport than they would necessarily to a public transport discussion. So yes, the conversations are integrated. David joined us at our last meeting to talk about how we might do that, so we will pick that up about who best at a strategic level to make sure that that input gets to IGB, and any support Julie, yourself and Nicole can do to bring that into the IGB space. Happy to take that opportunity too.
Thank you, Alan. That's helpful. I don't see any other hands. So if we move on to the template, please, Stephen. Thank you.
Yeah, so board members, it's the two templates in appendices 3A and 3B, which is the digital one and the disability employment gap. So they are just up for approval and endorsement, or any other comments, observations that can be taken on board.
Do we have any comments from any board members? Otherwise, I think we'll presume that we're agreeing those templates. I just had one very minor comment, I suppose, and it was about measurability, I suppose, and making sure that where we're capturing desired outcomes, we're actually really thoughtful about capturing data that shows there's an outcome. And sometimes that needs to be quite specific in terms of the updates that we get. I don't see any other hands, so I think on that basis we're agreeing those, Stephen. Thank you.
And the next section is at 3.1.4, and this is the work that's been ongoing through, well, it's the renamed Public Health Input into Community Planning Group, which is a bit of a mouthful, but it's been useful in terms of helping to shape the way forward. And as mentioned before, we've got our next item, which is really closing off the end of year for 23-24. It's a transitional period because when the LOIT was launched in September 23, it was a kind of mid-reporting year from the previous LOIT moving to this one. So at the next item, that is a transitional report, and then what we see here at 3.1.4 is what we're proposing in terms of moving forward, which Valerie mentioned just a few minutes ago, in terms of that work that is ongoing through the strategic partnerships that are recognised as part of our community planning model, and that is the engine room at that local community level for driving that forward. And that's where we want to draw some of the information and examples to help strengthen our LOIT report. We also did a bit of benchmarking against other community planning partnerships, and it's quite a mixed bag across the country in terms of how they are presented, what they cover, etc. So we've tried to pick out some of the bits that we like and we think would be most helpful, and that's the bullet pointed list that you see on page 21 there, in terms of setting the scene, high level statistics, and then drawing on some of the really strong partnership projects, initiatives, etc. But also it's a place where, you know, the LOIP action plan model, which we have, it's a place to help, you know, showcase and evidence that work, and as a potential model for going ahead as well in the future. A section on the locality plans, but also again what we noticed is other community planning partnerships have included, you know, the work of the board itself or supplementary, so a bit of a space there just to tell that story, and we think that would be a good way forward. So that's the proposal as it stands, and we've got our January senior leadership team to try and firm that up, and with a view to try and bring in the reporting cycles forward rather than being later in the year, and try and make it more live if we can, based on the data that's available. Thank you.
Thank you, Stephen. Valerie, do you want to come in?
Yeah, just I think writing these reports is always a challenge, and I think it's trying to move it into a new space of, well, how can we actually have reports that are accessible for our communities to understand, and for them to understand the pieces of work that we're doing really together in partnership, and really kind of focusing in on that. So I think in being realistic about the kind of challenges that we face, because community planning is about tackling some of those long-term issues that we've got, but actually how do we measure, as you say, Marcely, the short-term progress that shows that we're kind of making some headway into it. So I think as Liz Manson's presenting the next, which is this year report, which has been the transition, and it is a kind of it is a challenging thing to do, to present these in a ways that speak to people and really kind of tell that story of the partnership work. But certainly we're keen to do it, and just kind of try and learn from those other partnerships in terms of that framework. Thanks.
Thank you, Valerie. Do we have any comments on the proposed approach, noting that you're going to finalise it next month? I would really support the 1-3-20 approach. I think it sounds great, and there's nothing like a bit of focus to actually make it really meaningful. So personally, I think that's a really good idea. Any other comments? No. Okay, I think we're happy to note the progress with that, Stephen and Val. Thank you.
So the last section is at 3.15, just on communications, and there'd been a previous request to develop an easy-read version of the LOIP, and that's attached at Appendix 4 as a proposal over 2.5 pages. It's just got some simple graphics icons at the moment, but you know, if and when agreed, we can get it looking a little more presentable. But it's just to try and simplify the language. The suggestion was to use the format that the Health and Social Care Partnership had used for that plan, so it's based around that. So again, it's there for feedback, comment at the moment before we take it any further. Thank you.
Thank you, Stephen. Do we have any comments today on this? I'm presuming there's a bit of time for people to feedback specifically if they've got thoughts about what it currently looks like. I think basing it on the Health and Social Care template is a really good idea, because we know that that's accessible for people that need to have accessible versions. So yeah, I think it looks good. Thank you. Okay, do we have any other comments in terms of that item? I don't see any hands. Okay, so if we now move on to item 4, please, the LOIP End of Year Report 23-24. And I think Liz is going to take us through the report. Hi Liz, nice to see you.
Hello, good afternoon. Yes, so hopefully for members this is a recognised approach and format, that we have lifted the national information which is produced through the Improvement Service, and all 32 community planning partnerships are encouraged to use the same set of national profile information. And it has given us a trend over the years, as well as measuring ourselves against Scotland. So that information that these outcomes profiles have been allocated to the most appropriate one of our local outcomes. In addition, we have other national outcomes, and we have some local indicators and local projects which tell you the work that has been taking place to address each of the 12 outcomes in our LOIP. And finally, there is a case study or a personal testimony, and I'm sure the board every year is always particularly grateful to the people who have shared their story, because obviously some of them are indeed very personal, and tell you the journey that people have been on in our region. And that also gives you some qualitative information so that you can see the impact of the work that's taking place on an individual's life or through a community group. So we hope that taken together, that information tells you about the progress in each of the 12 indicators, and then you'll see a summary about the overall progress at the very start of the annual report, so that you as a board have got that sense about the progress that has been made over the reporting year. So I'll stop there, and happy to receive any comments and suggestions that you would like to see in the final version, which will be published and put on our website and shared with partners as the statutory requirement. Thank you.
Thank you very much, Liz. Can I ask people for comments? Is there an opportunity to feed back to you out with this meeting, Liz, if people...
Yes,
need a bit more
indeed.
time?
Perhaps we could say maybe end of next week, something like that, if anybody's got anything specific that they would like us to add in.
Okay.
Or indeed, if there's any data in terms of statistical information that you would like us to add in or look at, we can do that. We would like, I think, to publish it before the end of the year. So if that timescale was suitable for people, that would be really helpful. Thank you.
Thank you, Liz. That's helpful. I just had one comment, really, in terms of, and you just touched on it, that kind of specific data. The Good Share project, the outcomes that are listed there on page 53, they're very general. I just wondered if there's an opportunity to maybe make some of those a bit more specific in terms of the number of people who've been able to live independently at home, or whatever might be appropriate in that set of outcomes.
Yeah, very happy to go back to the submitters and ask them for some more quantitative information for that. Yeah, that's a helpful suggestion.
Thank you very much. Okay, so I don't see any other hands in terms of the content. You were asking us also to consider the progress assessment at section 3.5 and stating we've made good progress in 2 outcomes and satisfactory progress in 10. Unless people have other comments, I think we should probably agree that, because I think that's what the report's telling us. And at 3.6 and 2.7, we've talked about the future annual reports, and I think we're noting the arrangements for those as well. So with no other hands up, I think given Liz's offer to receive comments, we should take that up if we can, and we note the other updates. Liz, thank you very much. Okay, so we're now going to take item 6, as I indicated at the start of the meeting. And I think Jamie Little's going to be joining us to take us through a short presentation on housing challenges and the emergency action plan. Jamie, hello. Welcome to the meeting. I'll just hand over to you. Thank you.
Yeah, afternoon, everyone. Thanks for inviting me along to the meeting today. Hopefully everybody's had a chance to look over the report we've presented here, highlighting the work we're doing to develop a housing emergency action plan in Dumfries and Galloway. This was, as is set out in the meeting, was a declaration that was following the notice of motion submitted to full council back in June, 27th of June, and since then we've been engaging with stakeholders to ensure we pull together an effective action plan to try and tackle the housing emergency that we've chosen to declare in Dumfries and Galloway. At the time, we were the 9th local authority to declare this position There are now 12 local authorities in total that have done so across Scotland. I'm sure many of the people on the call will be aware that there also has been a national housing emergency declared by the Scottish Government. Just a little bit of background to the engagement that we've carried out. We have been in discussions with a number of relevant stakeholders and partners, organisations around pulling this action plan together. That's included our own homelessness and housing options colleagues, staff from the Adult Health and Social Care Partnership, Scottish Empty Homes Partnership as well, Shelter Scotland, and also the Scottish Government have been engaged in terms of development. But critical, and hopefully this is set out in the report, has been our engagement with South Scotland Enterprise and the development of the South Scotland Housing Action Plan, which was published the month after we declared a housing emergency for the region. And this sets out a clear objective around delivering more homes in the region, recognising all the economic benefits and drivers for doing so. And while that's not entirely focused on the housing emergency, we would expect that the delivery of more homes is likely to be one of the outcomes that we put forward to committee at the end of January. This will be going back to the Tackling Poverty, Inequalities and Housing Subcommittee for final approval in terms of the action plan at the end of January. But ahead of that, on the 7th of January, we have an elected members seminar where we'll be going over the current version of the draft action plan with them at that time, and having a discussion about where we prioritise our efforts and potentially put our resources into projects as well before taking that one back to committee. Hopefully that's given everybody a reasonable overview of the work done to date, but I'm more than happy to take any questions.
Thank you very much, Jamie. Do we have comments, questions from anybody? I can't see everybody's hands online, so I don't think we have any. I just had one question in particular in relation to the covering report, the stakeholder session report that you provided to us. And in there it says 25 million rural affordable homes fund for key workforce housing was available. Did we get any of that in Dumfries and Galloway?
So the funding for that hasn't been specifically allocated to any regions. It's a national fund that's available for people to bid into, effectively to buy back empty properties or to renovate empty homes to bring them back into use for key workers in rural areas. Currently, we are undertaking a key worker housing survey in partnership with Scottish Borders Council, South Scotland Enterprise, Scottish Futures Trust and South Scotland Community Housing, to understand where the demand, where the pressures are, and the intention is from that research that we'll be in a strong position to work with either resident social landlords or community organisations to utilise that funding. But there was no specific allocation made to any of the local authorities.
Okay, that's helpful, thank you. And can I just ask about timescales in relation to that survey?
Yeah, so the survey has just literally been launched this week. That's gone online. We've been targeting a number of different organisations to seek their responses to the Key Worker Survey. And intention is also to try and publicise that wider through social media channels, which we're going to work with communications colleagues on. But the intention is for this piece of work to be completed before the end of the financial year.
Okay, thank you very much. I'll bring in Councillor Thompson, please.
Yeah, thank you, Chair, and apologies for joining the meeting late. It was just due to a clash. Just on the Affordable Housing Supply Programme and looking forward, what impact do we think in terms of supply chain contractors and basically the cost of building houses will that have on the number of houses that can be built? I'm thinking in particular of employers' national insurance contributions, which will have some kind of material impact in the costs of getting stuff done in terms of employment. So I'm just wondering, do we have any sense of what additional impact that might have in terms of, compressing the funding in terms of what it can deliver in terms of units? Thank you.
Yeah, thanks, Councillor Thompson. It's a challenging question, and when we look at the whole picture here on the affordable housing supply programme, we have to highlight that over the last 5 years, there's been significant increases in the overall cost of delivering projects, and we've been looking to engage with the Scottish Government around changes to the affordable housing supply programme in terms of how we utilise the funding. Effectively, it's set out with benchmarks around that act as a guide about the amount of funding that can be made available. But the rising costs on the construction sector as a whole are making it really challenging. And in a rural region such as Dumfries and Galloway, where we would highlight an average house build cost for affordable home of around about £300,000, in comparison to a national figure more in the region of 200 to 250, we have additional challenges down here. Overall, the impacts are potentially quite significant for Dumfries and Galloway. Rising costs are one of the issues, but an uncertain funding picture for the future also puts a number of our projects in jeopardy, with registered social landlords expected to put their own resources into projects at an early stage for feasibility studies, designs, any surveys or assessments that are required before they can start drawing down further funding from the Affordable Housing Supply Programme. Clearly, there's going to be a reluctance to do that when there's an uncertainty about future funding. So we are trying to work really collaboratively with the registered social landlords and the Scottish Government, but without a fixed position on the future funding, it does add to the challenges. One of the many parts of the challenges that we're facing at the moment.
Councillor Thompson, you want to come back in?
Yeah, thanks, Chair. And no, I appreciate that, Jamie. I think the key thing is maybe that supply side inflation. You know, that sort of pressure where it is difficult to. There's more challenges maybe because of the nature of the region in terms of taking forward projects. But I think I'm trying to draw the distinction between the funding, which I know obviously we would always want to try and seek to improve, and the costs. And I'm just thinking that prior to this, one of the costs that wasn't factored in was the additional employment costs. So I'm just wondering, is there a piece of work to be done where we're engaging with local regional social landlords or other suppliers, where we need to get a better understanding of, okay, even if you get a funding security going forward, what are the additional costs that might be part of getting the job done in terms of recruiting people or contractors or whatever it might be. So it's really that part of it that I'm trying to focus in on, not the funding per se, even though we continue to lobby for that. Thank you.
Yeah, thanks, Councillor Thompson. Yeah, I'm certainly happy to try and take on a further assessment of what the impacts of some of these additional costs will be, and we can do that in collaboration with many of our partner organisations, the registered social landlords, as you mentioned. But I think there's some work underway already with South Scotland Enterprise to engage with local SMEs around the impact they're facing in the construction sector and how we can better support them to utilise or to be scaled up to be part of the affordable housing supply programmes in the future. So I'll certainly take that action away, Councillor Thompson, and discuss that further with colleagues from South Scotland Enterprise.
Much obliged, thank you.
Thank you, Jamie. Julie.
Thanks very much, Chair, and thanks, Jamie, for the report. I thought it was really interesting, and firstly I want to say thank you for the engagement that you have had with colleagues from the NHS and the Health and Social Care Partnership in relation to this work. But I thought it was important in the space of the Community Planning Partnership Board just to highlight how this work is absolutely critical to the ongoing sustainability of health services within the region. I think we see in a number of areas the risks associated with the potential sort of any reduction in funding or future supply of social housing, the impact that will have on people's health and well-being. I think certainly, again, another factor in relation to housing for us in health and social care is that any reduction in funding for adaptations for housing associations and the impact that has on people being able to return home from hospital or to sustain individuals at home in their own tenancies. So I think, you know, colleagues will be aware within the Community Planning Partnership that we are seeing really quite significant increasing challenges at the moment in securing housing for people who are leaving hospital, whether that be from DGRI or from Mid Park Hospital, and some concerns about growing waiting lists for housing for people with complex needs who require that specialist supported accommodation. So I think certainly I would just want to flag around this table the importance of us when we're considering supply of housing, taking account of giving priority to those groups to support those more vulnerable individuals living at home, and absolutely recognise, Jamie, the paper that we have in front of us does address and certainly mentions a number of these issues. The other point I was going to raise was around that supply of housing in terms of key worker accommodation, and again for us, given our other challenges within the region around recruitment and retention of staff, the availability of that housing network is absolutely critical. So really pleased to see these represented, Jamie, and if I had a question around that, would really be around how are we going to prioritise our work, because, you know, I've identified from a health perspective a number of areas that I think are really important, but I know from all partners there are key challenges. So when we are working through this piece of work, either the housing strategy or the emergency sort of plan, how do we prioritise resource to target it at the areas where we think we'll get the greatest benefit?
Yeah, thanks, Julie. It's a really good question about prioritising resources, because you're completely right. If we focus in one area, then there will be others who are impacted by not getting the support. And just for awareness, there was a decision made at the last Economy and Infrastructure Committee for the chair to write to the Scottish Government to highlight both the impact of the cuts to the Affordable Housing Supply Programme in Dumfries and Galloway, but it was also raised around the adaptations budgets. And I'm sure you'll be aware that, in particular to the registered social landlords, they've been very late in getting their budget allocations and were seeking far more support than they received. And this is something that we're dealing with on a daily basis in terms of the challenge around adaptations, as you know. But in terms of targeting resources, the reality is we're going to have to look at the areas where there's the most need, the most demand, and try and focus on what we can deliver within a reducing funding picture. We have just completed our housing need and demand assessment for Dumfries and Galloway. That's now published online, and I'm more than happy to share that with members of the Community Planning Partnership Board, which highlights out a number of priorities. But we are also in the early stages of developing our next local housing strategy, which will also highlight the areas we want to target for specific focus. And the Adult Health and Social Care Partnership are represented on our working group there, and that's critical. There have been a number of projects we've worked together with the Adult Health and Social Care Partnership on to deliver homes to promote independent living, or bringing people back to live in the region when they're in out of region, very expensive placements. We are supporting the care and repair service as well through funding allocation on an annual basis, but there is more and more demand on these services. And we really do need to take that strategic look at where the focus needs to be. And it is very challenging. I can't say that I have the solution right now, but hopefully through developing the local housing strategy, we'll be able to really pull out where those priorities need to sit.
Thank you, Jamie. Just before I bring Councillor McFarlane in, I just want to note that in the chat, Stephen Meikle has said he shared the key worker survey across his organisation. So just to note for our minutes for that. Councillor McFarlane.
Yeah, thank you, Chair. And following Julie's comprehensive question, mine's fairly simple. On page 106, we're saying that 2% of dwellings are long-term empty. Now, it might link into what Julie was saying about accommodation and such like as well. But I wonder, James, you could help us understand what long-term empty is. Are they likely to be available to be utilised? And what sort of numbers are we talking about when we're saying that? Thanks.
Yeah, thanks, Councillor McFarlane. So long-term empty is specifically residential properties that have not been in use as a home for more than 12 months. Obviously, as you'll appreciate, there can be a number of reasons for that. And the longer they're empty, obviously, the more challenging it becomes as well. In terms of numbers, I don't have an exact figure to hand. We do receive a report from our council tax colleagues on a monthly basis highlighting the numbers of long-term empties, but it's within the region of 12 to 1,300 properties that are highlighted as being long-term empty within the region, and they really are a challenge to deal with them because they can be dispersed right across the region. They may be in some settlements, they may be in completely rural areas, and often engagement with owners and landlords is very challenging. But within the Strategic Housing Service, we have responsibility for tackling empty homes, and we are embarking on a piece of work that we've just been discussing today around approaching long-term empty property owners to try and see what resolution or what support they need from the council to try and bring them back into use. This is intended to feed into the Housing Emergency Action Plan that we bring back to committee at the end of January, and also feed into the development of following the review of the Town Centre Living Fund for how we target our funding in 24-25. So there is a lot of work ongoing in the background at the moment, and we'll certainly aim to keep members appraised through the committee process and also through separate briefings as this develops.
Thanks, Jamie. 1,200 houses is quite a lot, so clearly gives us a bit of scope to get some stuff done. Thank you.
Thank you very much. Thank you, Jamie. I don't see any other hands up. And you're asking us to ensure appropriate input and resources provided to support development and delivery of the action plan, and that there's collaboration to alleviate significant pressure on the sector. I think from the conversation today, and certainly no commitment from my organisation, we are absolutely key to being involved in this and fully committed to that, however we can help and inform. You've also asked us to consider and provide comment on the draft action plan at Appendix 2. And again, I'm sure there's a bit of time for people to come back to you more specifically if they need a bit more time to read that and think about it. Maybe a couple of weeks or something if people want to input to that. Other than what we've heard today, I think it's pretty comprehensive. And I think the only other question I had was in relation to your involvement in the depopulation work that's taking place. I know at the last Community Planning Partnership Board we had a paper about some work that was happening there. It'd just be interesting to hear from you, Jamie, about the interrelationship between what you do and that piece of work. Thank you.
Yeah, thanks, Chair. So in terms of the depopulation work that's ongoing at the moment, Andy Reid, the policy lead who's working on the depopulation project, is part of our local housing strategy working group. Certainly see that the depopulation work does have a significant focus on housing. I know there's 4 different elements, and housing being one of those challenges that's being faced, particularly across rural areas. So we're heavily engaged with Andy in terms of the development of that project, and that's going to be ongoing. The development of the local housing strategy is really clearly aligned to the approach that's been taken around the depopulation assessment as well, particularly for housing. So we're effectively seeing that the engagement we're going to be carrying out with elected members, with the Community Planning Partnership, with the public and with other stakeholders, they're effectively very similar questions, so there's a real opportunity for us to collaborate here and make sure that not only is the depopulation work able to be delivered around the final project that comes forward, but also that it feeds into the local housing strategy, so that at the appropriate time we can be using that as our tool to seek further support for that priority.
Thank you very much, Jamie. I don't see any other hands up, so thank you for attending today and for presenting.
Thank you.
Thank you. So if we now move on to back to item 5, if that makes sense, to the South of Scotland Regional Economic Strategy and links to the LOIP. I know that Gary Legg has joined us to speak to the report. Welcome, Gary.
Good afternoon, Chair. Good afternoon, everyone. Yeah, happy to lead this item. I've not got any slides as such. Perhaps if I give a summary, an overview of the paper before you, and then more than happy to try and field any questions. I guess the caveat at the start is I'm from South of Scotland Enterprise, but absolutely here as a kind of support officer to that regional economic partnership. There's a number of organisations around this table and indeed individuals that will be very familiar with the REP and familiar with that equal collaborative partnership. I guess probably just helpful for those that are less familiar, the South of Scotland Regional Economic Partnership, it brings together a wide and diverse range of expertise and interests. Certainly the two councils, a range of public bodies and agencies active across the area, but critically the education, private, third, community and social enterprise sectors too. And indeed, picking up on that previous discussion, RSLs at the table as well for the reasons that you've been discussing. Partnership, I guess in really simple terms, is united by that common purpose to make the region the best that it can be. To date, been very much focused on overseeing the delivery of the South of Scotland's first regional economic strategy, and that was launched back in 2021 following extensive engagement. At its heart is a shared vision for a green, fair and flourishing South of Scotland. And underpinning that vision are 6 key themes, all interlinked and of equal importance. Swiftly following the publication of the strategy was a delivery plan that really sought to highlight the specific actions that we would seek to take as partners, working collaboratively, that really focused on those opportunities that required that collaborative and regional response. That was a 3-year action plan. It looked ahead from 2021 to 2024. And in the blink of an eye, here we are in 2024. I think fair to say some great progress has been made against those initial actions, and some of those are listed in the paper. I'm not going to run through them all, but New Invest in South of Scotland website is right up there. Again, you've touched on the launch of the South of Scotland Housing Action Plan, the need for an urgency of that. As well as the development of the South of Scotland Responsible Tourism Strategy. And as I say there, just to highlight, there's a series of other key achievements to date. The opportunity's been taken to review the plan. And I think fair to say, as again we've set out in the paper, that a couple of drivers for that, but critically, I guess, two I'd highlight is that desire from partners to arrive at a consensus on a smaller number of areas for collaborative action. I guess ultimately, in simple terms, again, helping to sharpen our delivery focus. That first plan had 47 actions, which with the benefit of hindsight was probably far too many. The second key driver as well is just to reinforce what action should be within that and where that sits in the context of other plans and strategies across the region, and indeed, of course, yours as a community planning partnership. And really trying to articulate and drive regional collaboration, providing that focal point for partners to come together on the big things where they genuinely need to, where no one organisation alone could make that progress. Really timely update in the sense of the Regional Economic Partnership has just launched back on the 27th of November, that updated delivery plan. I'm delighted to see they've succeeded in sharpening that delivery and focus by setting out 3 what they're calling priority actions. You've maybe heard us talk about these in the past, referred to as the 3 grand challenges across the region, the biggies that if when unlocked will be a real kind of catalyst to enabling other things to fall into place. And they are the delivery of more homes, opportunities to enhance transport connectivity, and developing proposals to expand and adapt skills provision to meet future needs as well. Supporting those or alongside, I guess, those 3 priority actions, again, you can see in really headline terms in the paper before you is a wider 9 actions, which again cut across a range of things from inward investment to natural capital to creating pathways to net zero, as well as digital interventions, community wealth building, etc. And again, I won't dwell on them, the details are before you. Critically, we shared with you and should have been appended to the paper what was at that point a very final draft of the delivery plan. The version that's been published should only differ from that which you've got in the sense of some final proofreading was underway. Critically, I guess what you'll see is that the 12 actions in the refreshed delivery plan deliver against a multitude of your LOIP outcomes, real explicit in places, particularly those for transport, particularly those for housing, which again we've spent time on, and particularly those for the economy. But a range of those actions do stray across as well into some of those wider objectives about health and well-being, for example. What I should say is work is still ongoing to develop a performance measurement framework for the regional economic strategy. And that work is very alive to those LOIP outcomes, both on this side of the region in Dumfries and Galloway, but critically those across in the Scottish borders as well. I guess finally, before we come on to the ask, just to note that there is some really good work ongoing at the moment in terms of promoting the delivery plan, in terms of a communication strategy around that. The REP has got a new website, which is great. The REP now has dedicated social media channels, so expect to see some noise, not just in the short term, but across the longer term, to really raise the profile of the REP, progress in the delivery plan, and what they're busy with and what they're achieving. And finally then, I guess what you're asked today as a partnership to invited to do is to note the refreshed delivery plan, which has been endorsed by obviously the REP, but by a number of core partners as well, including, I guess, of relevance, Dumfries and Galloway Council, and note that it will support multiple LOIP outcomes. I think within that, it's really important to be aware that it's there, to know what we're focusing on, to think about how you as an organisation, as individual organisations might already be doing some work. I guess at this point, helpful to say, whilst we list within the plan itself key partners, that's not intended to be a sort of inclusive or fully inclusive list. So if you're sat there, look at an action within that delivery plan and think, hold on a minute, I'm doing some really good work in that space, I'm not listed as a partner, please do reach out, shout up. The whole idea is that others will come on board with some of those actions as well. And I guess linked to that, the final ask of you today is to consider how, as a community planning partnership, again, as individual organisations, or indeed as this collective, can continue to support that regional work to deliver the 12 actions in that delivery plan, again, through the obvious an important fact that they will absolutely contribute to those more localised LOIP outcomes that we're all here to help deliver as well. So happy to take any questions, Chair.
Thank you very much, Gary. Do we have any questions or comments for Gary? I don't see any hands up yet. Oh, you have? Yeah.
Thanks, Gary, for the comprehensive update. It was just on the priority actions, and earlier in the meeting we were having a chat about digital and just the LOIP action plan. So it was just action 9 in particular. I think there's closer joined up work we could do around that one. Certainly we are going to have a more detailed chat at our leadership team meeting in January. So through your own rep on that one, we can maybe touch base on how we can help with the work, join forces to work on that one. Basically, I think that would be a good way forward.
Yep, I think Stephen would absolutely welcome that. I think, being totally honest, it's an area where we've struggled in. So previously in the last delivery plan, the focus and much of the talk there around digital was around digital exclusion, and a link to the brilliant work. I see Alan's got his hand up, but the brilliant work that the third sector interface in Dumfries and Galloway had led on. The scale and pace in the digital world is quite challenging, and challenging in a good way, again, in terms of, if we cite Borderlands and the investment there, in the time it's kind of taken to get to where we are now. The world's overtook us, and some of those things we wanted to fund have happened already. So really trying to hone in and be clear about collectively what are the big digital challenges and how we can work together is a real kind of dilemma at that regional level at the moment. So absolutely welcome that, be keen to get along and yeah, involved in that debate.
Thank you, Stephen. Thank you, Gary. Alan, if I bring you in.
Yeah, thank you, Chair, and thanks for the overview, Gary. I suppose a general question, maybe just as much to other board members, Chair, as it is to Gary. I'm sure he'll have some views too. But there was previous conversation just linked to the latest transport update that I gave. So, for example, Tom and I have taken an action to go away to make sure the work of the Community Transport Strategic Development board fits within the subgroup for transport and the rep, and therefore is contributing to the wider outcomes. But you can see that it actually becomes quite resource heavy. So we have individual organisations working in D&G. We then have this partnership that brings together those organisations, and we've got a whole South of Scotland view. So I suppose I'm very thoughtful about, rather than leaving it up to individual partnerships to integrate the work, whether there's some thought needs to be given at the from a board to a rep priorities level, for example, about how we make sure that we're maximising the use of all of our resources to deliver on the outcomes, given that most people probably in this room are also represented on the rep too, and whether we've got a good enough alignment between individual organisation work, the outcomes we want from LOIP and the rep action plan. So I don't have a solution to it, Chair. I'm just very thoughtful of, it takes a lot of effort to join up all the plans, and there's a general operational question that comes from teams about which one takes precedent. So I'm very thoughtful of that. If Gary has some views on how we do that, as I said, in transport, we've already picked up the need to do that. But it seems that doing it by individual partnership becomes really complicated. So I'm open to hearing thoughts and views on how we maybe get better at some of that alignment. Thanks.
Thank you, Alan. It's a well-made point. Gary, do you want to come in?
Yeah, I mean, I guess it's acknowledged as a challenge, and I guess the key principle we've taken, certainly at the rep level, is to try and utilise existing structures as far as we can without cluttering what's already, I guess, a cluttered landscape in some instances. All the more important, given resources across, I guess, all of our organisations are absolutely stretched, and no silver bullet on the horizon in terms of addressing that. I'm much closer to the housing work. So again, I guess easier for me to relate to that, but I think there was a real conscious effort there to be very clear about where we can add value, about how we can come together, and how we can kind of not step on what's already a very, very busy landscape. And I genuinely think we've succeeded in that. Alan, great that you're involved in and included in the kind of transport work. I think they're making some good progress, but they're a little bit behind. So I guess the onus is on us all to kind of call out that duplication, to constructively challenge and push back where there's asks that seem again unaligned asks or duplicative asks. I think that's the things we really want to know, and I guess that's why sometimes, as this will be very familiar to some of you, it won't to others. So coming along to these kinds of forums and raising awareness to be able to do that and make some informed constructive challenge back, I think is really important.
Thank you, Gary. Val.
I think it's a really, really challenging. Sorry, Gary, it's Valerie White. It's a really, really challenging area, isn't it? Because South of Scotland, it's the borders and Dumfries and Galloway. So in some ways, you've got the kind of two areas, don't you? And I imagine there's probably two LOIPs as well. So it's not easy, and it's how do you join up that and maximise the kind of those resources. And I just wonder, Gary, and it's just a thought, if maybe we kind of take some of this conversation into the kind of community planning senior leadership team and actually kind of tease out some of these and go, right, well, what partnership does that align to in D&G, or what aspect of our LOIP, and maybe kind of tease that out a wee bit, because it might help. I don't think there's any easy answers to this apart from just sitting down and kind of really talking through it, which in forums like this is quite challenging to do. So, but it might be worth taking that time, because I think the last thing we want to do is duplicate work, because nobody's got time for that. But there might actually be like aspects of a project that, you know, the regional economic partnership have got a stronger voice in that space. So I suppose it's maybe just teasing that out might be something that might be helpful to try and attempt to do.
Yeah, I think again, welcome that, Val. Absolutely.
Yeah, I think Stephen's nodding with that as well, so I think the leadership team is a good place to have that conversation. I was very thoughtful about your question around, are there organisations which are not mentioned in some of your actions? And I'm interested in the Net Zero Action 6. It might be useful for the NHS to be involved in some of those conversations. We may already be, but I'm not sure that we are. But we've got quite comprehensive plans and ambitions around or net zero. And as you'll know, the NHS has a huge carbon footprint, so it might be helpful to join the dots on that. And I had quite a specific question around your priority action 1 and the homes. It feels like the REC would be a really good place to explore care villages. And we've talked for a long time in NHS and social care about the potential and the usefulness that there might be to have care villages in Dumfries and Galloway. And I wondered if that was something that you'd touched on, or whether you had any thoughts about, Gary.
Yeah, okay. So quickly on the net zero one, yes, I think we're really keen to draw in the right partners. Net zero is huge. I think it's the one where we fudge the key partners and refer to which is ongoing, that comprehensive stakeholder reason for that very genuine reason. I think on housing, again, we took a very conscious decision on housing. So going back to that point about being very clear about where the rep can add value, where it needs to focus. So we took a very conscious decision as a subgroup to focus on housing which will support the economy and help grow the economy. We spent some time talking about housing for older people, and I guess care villages being a key proposition within that, but felt that was sufficiently addressed within both of the local housing strategies, a very up-to-date one on the border side, and as Jamie's touched on earlier, an emerging one. That said, some of the work we're nevertheless doing around the housing action plan, really obvious example is getting out there, better promoting the region, addressing some of the misconceptions that's preventing more developers and more players coming in to the region, will absolutely benefit and help with some of those wider objectives as well. Absolutely fully alive to, I guess, the potential of care village. So we know, based on housing strategy work, key blocker to people that are under occupying good family homes is the lack of that alternative, of that place to go. So care villages could have a home. The other key thing, the final point on that one, Chair, is I think what that group gives us now, and it's very well established and sleeves rolled up in Into Action territory, is a forum, so we can discuss that if there's a significant opportunity or a strategic conversation to have about that. We've got that ready-made forum where we can bring that to.
That's really helpful, thank you. I think it's that inward investment piece as well, and attractiveness for businesses that's important in that area. Councillor Thompson.
Yep. Yeah, thank you. It's kind of on the back of the net zero element, and obviously in the upcoming regional economic partnership meeting this Friday, there's a paper that will be there for members to consider around the future governance of the regional land use partnership. And the reason why I raise that is there has been some concern, and including with this council, in terms of notices of motion around biodiversity, for example, and how land is used. So there's a sort of public concern around are we getting the best value out of that, and particularly around things like greenwashing and carbon credits and things like that. So I suppose by the back door, in a way, there's certain ways that we maybe aren't in full control of how our assets are used in terms of being used towards net zero under our control, and that there's maybe agents or companies or pension funds or whatever it might be taking advantage of a device, if you like, that could actually run contrary to some of our priorities in terms of our council plan and also the regional economic strategy. So I'm just wondering, would it be worth having some kind of government spokesperson that maybe speak to either this body or the REP or a relevant body within the REP linked to this, so that we can fully understand what are going to be the challenges achieving net zero, for example, if these other factors are at play, if that makes sense. Thank you.
Yeah, Chair, do you want me to come in on that?
Yes.
So I guess, Councillor Thompson, I think that's a valid point, I think, to raise on Friday. What we've tried to do, or what we tried to do in the previous delivery plan, was ensure across the programme of REP meetings there was an adequate focus on each of the theme and actions within. So I think only right that we programme ahead to make sure we're having that proper discussion on the net zero piece and the action, and can absolutely draw in appropriate other SG officials or whoever to help ensure an informed debate and discussion. I think you're right. It's a really complex one, isn't it? There's real overlap there between kind of the natural capital aspects, RLUF, and the net zero piece. It's fairly complicated, a difficult one, but I think raise that point. I'd encourage you to raise that point on Friday, and we can have a kind of fuller response to it at that point.
Councillor Thompson.
Yeah, no, thank you, and I appreciate that, Gary. It's maybe not the correct forum or accurate forum, but the reason why I raise it here is because each of the partners around the table will have their own designs on reaching their own net zero in terms of improving their efficiency towards carbon. And again, I think you probably, some of the conversation earlier was around avoiding duplication and about how can maybe be more effective at achieving a regional goal rather than just necessarily our own individual organisation's goal, and how we could support each other towards that. Holistically rather than, I suppose, by, duplicating things, which is anathema to this body, I'm sure. But so I will raise it on Friday. Thank you for that. And but it's really, I'd be interested to know, as a partnership board, do we have to be aware of these things while we take care of our own estate's ambitions for net zero? We're actually working collectively as a partnership. So it's really in the spirit of partnership, I think I'm getting at. Thank you.
Yeah.
Thank you for that. So Gary, you've asked us to note the refreshed delivery plan, which I think we're doing, and we've remitted the complexity across reporting and the mapping of that to the leadership team. So we'll take that as an action in terms of how we can continue to support regional work to deliver the 12 actions in the delivery plan. I don't see any other hands up, so thank you very much for coming along. Really interesting discussion.
Brilliant. Thank you very much, Chair. Thank you all.
Thank you.
See you.
Okay, if we move on to item 7, updates on key plans and strategies. This is the standing update on plans and strategies that contribute to the Local Outcomes Improvement Plan. Key points are highlighted in the overview paper, which Stephen will take us through. We'll then go through each plan in order to allow board members the opportunity to comment or to ask questions. Thank you, Stephen.
Thank you, Chair. Board members will recall that we agreed to reduce the number of updates at each meeting and to move those on a 6-monthly basis, just to try and spread and ease the burden on report authors as well. So we have 4 updates today. Probably the most significant is the first one you see in terms of page 115 of your papers, the Alcohol and Drug Strategy Annual Plan, which is very impressive and contains some really critical information. The key highlights being, of course, the number of drug-related deaths have dropped from between 23 and 24. The number of naloxone kits have increased significantly, which is a great success, and also a slight decrease in the number of alcohol-specific deaths, which is really important for our region, obviously. So the Appendix 2 contains the more detailed plan, and the leads for the Alcohol and Drugs Partnership would welcome any comments and observations on their plan. In terms of the Employability and Skills Plan, again, some good successes there. You will see from the headline figures that the number of individuals that are engaged has increased from 273 in 23 up to 684, so significant progress there. It's a small update on the regional economic strategy, but obviously we've just received the substantive one there, so nothing too much different to add there. And in terms of poverty and inequalities, there's been a bit of a review of the subgroups and how they work, but the focus is obviously now on preparing for the winter and that support to our most vulnerable. So that's really the summary, and as the Chair has said, we can go through each one individually to see if there's any comments or observations. Thank you.
Thank you, Stephen. Does anyone have any comments or questions on the alcohol and drugs strategy update? Val?
Yeah, I suppose while it's heartening to see the drop in drug-related deaths that we saw in 2023, unfortunately 2024 doesn't look as if it will be in such a good position. So I just really want to highlight the Community Planning Partnership that this continues to be a real area of challenge for our region, and a key point that Penny Halliday, the chair of the Alcohol and Drug Partnership, is always keen to bring forward is that there's a lot of stigma around for people who use drugs and alcohol, and we need to try and reduce that stigma so that people feel comfortable to come forward to access support and services so they can be supported through that, because it is a chronic long-term health condition which I'm sure nobody would wish on anyone, and we need to view it as that. So thank you.
Thank you, Val. I'll bring in Councillor Dorward.
Thank you, Chair. I would echo what Val said. Thank you for your comments. But I would also draw the Board's attention to page 131 in terms of recovery-orientated systems of care access to services. The portion of people who wait longer than 3 weeks to start drug or alcohol treatment has consistently remained above the national waiting times target, and substantially fewer people had a residential rehabilitation placement in 23-24 compared to the previous year, which isn't good. And as Val said, this is an illness, a chronic illness, and one death is one too many here, either through alcohol or substance misuse. So I'd make a plea that we keep an eye on that and don't just focus on the stark statistics of alcohol and or drug deaths going up or down. It's much more complex than that. Thank you, Chair.
Thank you, Councillor Dorward. Val, do you want to respond to that?
I was actually struggling to hear that just a wee bit in terms of the data that Councillor Dorward was referring to. Sorry.
I think Councillor Dorward was referring to the rehab capacity. Page 131.
May I come in, Chair?
Page 131 of the paper.
If I can come in again, Chair, if you can hear me, it's page 131, Val. Recovery-orientated systems of care. Just draw attention to the fact that the statistics are not great at the moment, and that treating people with addiction issues is much bigger than just looking at drug or alcohol deaths, and every death, one death is one too many. Thanks, Val. I hope you heard that properly. Cheers. Thanks, Chair.
Sorry, Julie, now just looking at it here, that is actually positive because it's better than the national waiting times. So I think it's maybe just the way it's written.
It's people. It's the waiting time is for people who wait no longer than 3 weeks for treatment to begin, and we're better than the national average. So I think it's around, I don't have the exact figure in front of me, Councillor Dorward, but I think it's about 95% of people in Dumfries and Galloway are seen within that 3 week waiting time standard, which is better than the national average. Absolutely recognise, though, the challenges about the residential rehabilitation placements, and that is something that's been picked up through the ADP, and absolutely concur with your position around every death, every person coming to harm as a result of alcohol and drug use within D&G is a real challenge for us, and is an area that we need to absolutely focus on to improve. But I think it's just important to highlight that performance target, we're actually performing well in Dumfries and Galloway in terms of our waiting times for access to treatment.
Thank you, Julie. If it's helpful,
If
it's helpful, Councillor Dorward, we can get you the statistics, if that would be useful. Val.
Sorry, I've just noted they are actually, if you go to page 145, ADP 1, it does actually give you those statistics, and we are consistently better than the Scottish average in relation to that, and it's highlighted as green. So that is there, and we are better than the average in Scotland.
Thank you, Val. That's helpful. Do we have any other questions or comments in relation to the alcohol and drug strategy? Okay, if we move on to the Local Employability and Skills Partnership Delivery Plan, do we have any comments or questions on that? Val?
I suppose just one of the comments I wanted to highlight, because we talked about this slightly at Community Plan and Senior Leadership Team, is that the work of the Local Employability Partnership is really, really, really important in terms of tackling some of the key issues that we are really, really concerned about. Having access to good work is so critical for health and well-being of individuals, and also for having individuals who economically active and able to contribute in the workplace and things. So I think it's really, I just want to really emphasise the importance of the work of that partnership, and it's great to see that there is engagement across our CPP partners and playing into that work, because I think that is something that we do need to have quite a bit of focus on and pay attention to. Thanks.
Thank you, Val. Yeah, you're right. It's critical to health, well-being and anti-poverty. I just had one comment in relation to that update on page 121. There was a really helpful update on community employability cafes, but it made me think about the transport challenges we have. So if you're, for example, if you're running in Stewartry, a cafe in Castle Douglas, there are as many people from Dalbeattie and Kirkcudbright who would want to come to that, who might be locked out because of issues with transport. So I think transport for us, as we've already discussed today, is so critical. I don't see any other hands. So if we move on to Regional Economic Strategy update, do we have any comments or questions? Councillor Thompson.
Apologies, Chair, I just wasn't quite quick enough. It was just actually on the, so I think we're probably aware that there is an increase in inward drift to the region of people who are less economically active but still of working age. And I just wondered how we sort of capture the impact of that in this, because maybe this is aimed at a slightly different target in terms of employability, but clearly, I suppose there's a creativity maybe involved in maximising the gain from everybody in the region who's able to contribute towards all our shared goals. And, you know, we don't need to look far to sort of hear of difficulties in recruitment, retention and all the rest of it. So I'm just sort of wondering, does that play a part in the employability strategy, given that demographic, quite sort of specifically local demographic shift, in that there might be more people coming in, but it's maybe not in the sectors that we would actually get immediate obvious benefit from, in the sectors where we have the most demand, if that makes sense. Thank you.
Thank you for Councillor Thompson. Do you want to come back, Stephen?
No, thanks, Chair. Thanks, Councillor Thompson. Yeah, really interesting question. I think the best way would be, I'll refer back to the Employability Manager to get a detailed update and then circulate that for board members, just in terms of that specific question. I think that would be the best way forward.
Okay, thank you.
Thank you, Stephen. Thank you, Councillor Thompson. Regional Economic Strategy we already discussed. Do we have any other comments or questions in terms of the update that's in there? No, okay. And then Tackling Poverty and Inequality Strategy. Do we have any comments or queries in relation to that? No, none today. I suppose my only observation was page 125. Reducing financial pressures. There is that huge overlay with digital exclusion. And if you're in poverty, we know that it's potentially more likely you'll be locked out of digital access, and so many services now are online. I think we need to take heed of the statement that Alan made right at the start about our ambitions in relation to digital are not necessarily as strong as they were, because that brings significant risks across a number of areas. Okay, so we have a number of recommendations noting the key issues highlighted and noting the progress made in relation to strategies and plans, and we have provided some feedback for officers to consider and respond to. If we move on, please, to item 8, the business brief, and Stephen and Valerie will speak to this report. Thank you.
Thanks, Chair. Quite a large update this quarter, as you can see from the first section. So the Community Planning Senior Leadership Team considered recent updates from the Equality and Diversity Working Group, the Cultural Partnership and the Participation and Engagement Working Group. So there was some key comments and observations made by lead officers to help support the work of those. So the first one was there was a keenness from the lead and support officer from the Equality and Diversity Working Group just to help promote the work they do, and their terms of reference is attached in Appendix 1. However, on page 153, there's a number of areas where they've highlighted that they're willing and able to support. So, you know, if any partner has any questions, impact assessment work or anything they just want to run past them, even informally, that they're very open to doing that and to providing that professional specialist advice, which has been informed through lived experience through that group. So that was certainly one to highlight. The second one is quite a significant update on the new cultural partnership, which some of you may know that Catherine Wheeler has been appointed as the independent chair of that partnership. And whilst the partnership is only really formally starting to get in place now, there's still been work ongoing on the actual strategy itself. So again, within Appendix 2, you can see the comprehensive work that was done to prepare that report, which hopefully would be of interest to you. At 3.3, which is page 154, again, the Participation and Engagement Working Group has managed to meet a couple of times during the year, but there has been some conflict which has required some meetings to be rescheduled. I think the key from this one and what was discussed was for it to have the biggest benefit. It's about that forward planning of consultation and engagement work. I think a lot of the time updates have tended to be retrospective, and therefore it's too late to make any amends. So there was a keenness from the lead officer to try and develop some type of forward plan in terms of consultation activities to maximise the benefit across those that are involved in that, to help troubleshoot any issues and share that best practice as opposed to it being reactive. So that was some of the key comments that were coming out of that work as well. At section 3.4, and thanks to the board members who took the time out to complete the community planning self-assessment checklist. I appreciate that was quite a short turnaround. All 32 partnerships were asked at the same time. So from Dumfries and Gulline, it was just confirmed earlier this week, so there was 12 completed responses, which have been advised is quite a high response rate. So again, that's very much appreciated. The next step is the Improvement Service are offering a workshop with board members to look at that, and that we've taken that request forward, and there's various dates available between January and May 2025, as you can see. So we'll reach out to board members to try and select a date from that. Also, what was discussed at the senior leadership team was potentially the March board meeting, to try and make that into a bit more of a workshop meeting as opposed to updates that we were regularly receiving. And I think today, you know, the complex landscapes came up numerous times, you know, during the discussions, and maybe some overlap between partnerships, etc. So the suggestion is, if we can manage it, to do a bit in the community planning checklist. There's the health equity work, population health that's came up. There's a whole lot of things in the horizon, and we think it'd be better to sit down and do that as a facilitated, you know, session and make best use of that time. So we'll keep board members advised of that and how that might look if you're agreeable to that. And then the next two, Valerie updated on the Health Equity Scotland expression of interest, and we unfortunately hadn't been successful in that one, but there's opportunities to share learning. And the population health framework is attached at Appendix 4 in terms of the response that was sent back on behalf of the board. And in between our last meeting, Public Health Scotland have also launched their systems offer to community planning partners, and that's attached to Appendix 5 for interest. Just before we move on, I'll maybe just ask Valerie if she's got any comments, particularly on 3.4, 5 and 6.
Thanks very much, Stephen. Yeah, I think I was jotting down some notes today about crossover between plans and strategies, best use of resources. You know, like there's, Stephen said, community planning senior leadership team last time, we're like, this is a very complex landscape that we're operating in, and you know, that's so fantastic to have those 12 responses, because actually there's such a commitment around this table to maximise community planning and to really focus in on priorities and what do we want to do collaboratively. So I think the feedback from those sessions, the questions that we asked ourselves in the health equity audit application, the population health framework might be published by then. It's looking like it's going to be the spring, but I think there's a real opportunity to bring all of this together and have a real kind of in-depth conversation about how we want to collaborate and focus our work kind of going forward in the context of the LOIP that we've got, but how do we do that? So keen to get board members' views on that. I do have a feedback session in relation to our application for the health equity audit, because I think we did put quite a lot of time and effort into that, so it's good to understand you know, the reasons why we weren't selected. I do know it was a very, very competitive process, and it may actually be that there was partnerships who were needing more support than others, so but I'll get that feedback and be able to update to the board in due course. And as I said, population health framework I think probably will be the spring of next year. I suppose just in relation to the public health systems offer, this was a piece of work that had come about from Public Health Reform, where COSLA, who are co-sponsors of Public Health Scotland together with Scottish Government, were keen to understand, well, what can Public Health Scotland and the local public health system offer to community planning partnerships. So that document is there. I would hope that community planning partnership would locally know where to come to if they're needing, you know, advice and support. And we do link very closely in the Public Health Directorate with Public Health Scotland, and they do provide a lot of input to a number of projects that we have ongoing at the moment. But it was just to flag that there's a couple of examples from Dumfries and Galloway in that document. So again, we're being actively showing the work that we're doing locally, so it's nice to see that. Thank you.
Okay, yeah. Thanks, Chair. Thanks, Valerie. So the last couple of points to bring to board members' attention is section 3.7, which is the guidance for fair funding of the voluntary sector. And again, at the leadership team, there was only a small amount of time to really look at that last month, but we've got it on the agenda for January. So within Appendix 6, we've got what is being proposed or promoted for consideration to support the voluntary sector, and board members are asked to, to provide their support or any comment or observations on that. And then finally at 3.8, and it was discussed earlier in the meeting at the housing item, and it was mentioned about Andy Reid leading the project in terms of tackling depopulation, or as the Minister mentioned at our session, repopulation was the term that was used and encouraged as well. So there's an up-to-date project update on where things are at 3.8.1. And again, just some information in Appendix 7, graphs in relation to population change and how that affects Dumfries and Galloway compared to the rest of Scotland at Appendix 7. So again, a full update in the business brief this time round, but happy to take any questions.
Thank you, Stephen and Val. Dawn.
Thank you, Stephen and Valerie. Just in relation to fair funding, the point that was made, just to recognise and thank Alan for having the conversations with me about fair funding, and through COGITS as well, the Chief Officer Group for the Third Sector. And from a council point of view, we're actively looking at how we can promote that and support that moving forward. And we know that we've got examples of really good practice already in relation to fair funding, and other areas where there are opportunities to learn from that best practice and look to support the principles of fair funding moving forward. So just to acknowledge that those conversations are ongoing, and to thank Alan for raising this with me in recent months. Thank you.
Thank you, Dawn. Do we have comments, questions from anyone else? Julie?
Yeah, I suppose I would just want to echo Dawn's comments in relation to that. I think the guidance for fair funding of the voluntary sector is absolutely critical for us all, and I think whilst I think as community planning partners should all commit to really thinking about what this means for us in our individual sectors in terms of the way in which we plan, commission, procure and engage generally with partners in the third sector. I think it would be, from the paper, I understand that community planning senior leadership team was keen to have a further conversation at its next meeting about what does it mean for us as partners working across the whole system, because I am sure that colleagues in third sector have got multiple different arrangements with the different partners in terms of what those funding arrangements look like, and I think it would be a real opportunity for us if we can look at using these principles across the community planning partnership to consider what that means in terms of our relationship with third sector partners and how we progress to addressing some of the challenges that are picked up within that fair funding statement. So, like Dawn, really committed to it as an individual organisation and keen that we as partners in the community planning partnership consider what this means for us in practice, to really think about what needs to change about the way in which we engage with partners in the third sector to deliver against these principles, which I think we would all agree are very laudable and important. But I think I'm really keen that we move beyond the agreeing the principles to really thinking about what that means in practice and what changes we need to implement. Thanks, Chair.
Thank you, Julie. Just before I bring Alan in, with a separate hat on, I am involved in the third sector, and I think it's fair to say that it's not always about money. Resources can mean other things. It can mean support from organisations like our own, NHS, council, wherever that might be. Resources, I think, for me is about more than the pounds and the pence. Sometimes it's about how you feel you're being brought around the table and how you're engaged with, and the support that you're offered in kind, if that makes sense. So I would fully support this fair funding of the voluntary sector approach, but I think we just need to think about that definition of what resources actually means. It's not, for me, just about money. Alan.
Chair, thank you, and absolutely echo your comments, and I appreciate comments from Dawn and Julie too, because we are having active conversations about how we do better. I think important just to share for board members that I do absolutely believe that this is a collaborative process, and this isn't just about asking for more money, but it's also, to Julie's point, about simplifying the process, understanding what collaborative commissioning looks like, changing our focus less on activity, more on outcomes and what can be achieved working together. And I'm absolutely committed, and I've already started the design of a new third sector collaborative model that I think could be really helpful to do that. I'm already working with Health and Social Care Commissioning team about the different approach you might take over the next couple of years. And what that means for all of the investments in third sector, but it also means quite straightforward conversations about looking across our organisations and where we do invest in the third sector and how we can bring those investments together, either to maximise their impact or at least streamline the process through which the third sector can engage with organisations to deliver on those outcomes. So we've got hundreds of examples of, even across individual organisations, there are 20 different ways to apply for funding and 50 different rules and different templates to fill in. Some of those things are really important to the sector as well. So just wanted to know, absolutely committed to doing the design together. And on that basis, to share, I think, my recommendation to SLT at the last meeting when this was first aired, that the community planning partnership does not jump to endorse the model until it understands what that looks like, what collaborative commission looks like, what fair funding actually looks like, and almost adopts its own model to do that. I think to jump to agree to the principles and then find it really difficult to deliver would just echo some of the frustrations that already exist in the sector. So a commitment to working towards, as opposed to a blanket endorsement of the paper and moving on, would be, I think, very welcome from the sector, and I'm happy to work with anyone who wants to look at some of that collaborative design, which I think is the key to changing how we all work together. So thank you, Chair, I appreciate that.
Thank you, Alan. Okay, are you done with the updates? Yeah. So we're being asked to note and consider a number of those updates. I don't see any other hands up for comments. So I think we are going to note the position, and we've discussed the fair funding, and the depopulation slide at the very end is pretty stark for us in Dumfries and Galloway. We are one of the most depopulating areas over the past 11 years, and I think we just need to bear that in mind. It's one of those huge cross-cutting issues that we've got as an area. Okay, if we move on now to item 9, the forward plan arrangements. Stephen.
Thanks, Chair. Just a brief update of arrangements for 2025. At section 3.2, we've got provisional dates at the moment for the board meetings. That's purely due to, we normally have them on a Friday, and the calendar for COSLA meetings, I think, still got to be confirmed for some, so that's why there's maybe 2 dates or provisional dates at the moment, and there's no Fridays available in December, so we're having to look at an alternative day like what we've done today for that meeting, and still planning to have, it will probably be 7 senior leadership team meetings, but as discussed at the earlier item, the kind of main focus will be on the March board meeting and developing that as a workshop, and then the leadership team can build up proposals for the co-chairs to decide in terms of forward business going forward. So yeah, that's the main item. Maybe Valerie might want to highlight anything, I'm not sure.
I'm just reflecting if we're coming together in March, Chair, that I wonder if it might, you know, when we're having a kind of more informal workshop-y type session, it might be helpful maybe to do that in person. Maybe, I think we've done some previously in the Bridge, Stephen, is that right? It just might be more conducive to having some of those conversations, I wonder. So just a reflection that might be something we would want to do in March.
Thank you, Stephen. Thank you, Val. Are people happy to note those draft dates and agree that we have a face-to-face workshop in March? I don't see any hands suggesting otherwise, so I think we're agreeing that. Thank you. Okay, so if we move on now to item 10, the Child Poverty Action Plan report. I know that Darren was intending to be here. I'm not sure if he is. Otherwise, I think, Val, you're going to pick it up.
Yeah, thanks, Chair. So we're running a bit ahead of time, and Darren had a rescheduled. Yes, so he might join later on, but if not, I think Valerie was going to take us through some of the key issues. Thank you.
Thanks very much. And I think this report has come here kind of really on the back of some conversations that we had at previous Community Planning Partnership Board meetings. Are what are we doing as community planning partners in relation to child poverty? And this is probably the first time that I think the child poverty annual report and kind of forward plan has come to the Community Planning Partnership Board, which does outline the range of actions that have been undertaken in relation to tackling child poverty, predominantly via the Council and the NHS, who have statutory responsibility to report in this area, but there are a number of partnership projects that are reported on in the document as well. As colleagues will see, there is a huge range of actions within the kind of previous child poverty action plan report, and what has happened following that is really further work to kind of, for a forward plan for 24-26, to kind of reduce the number of actions that are within the plan, kind of stripping out some of the kind of business's usual aspects of it and looking more to focus on that employability space. I know colleagues within the Council and the Local Employability Partnership have now a child poverty team in place, so looking much more to kind of focus kind of in that area as well. The report also references the Through Young Eyes film that was produced by our youth steering group, and the importance of having that voice of lived experience in terms of being informed and developing those plans going forward. So child poverty is obviously a key issue in Dumfries and Galloway. It is increasing. It's not something that any of us would wish to see, and I suppose it's reported in through the Poverty and Inequalities Partnership, but that's maybe something that we might want to pick up as well, about that actual, is this something that we want to see more visibility of in terms of reporting to the partnership board going forward, because there's certainly a lot of action kind of in that space, but as we've cross-referenced, there's lots of supportive and interlinking actions that happen in other plans and strategies as well, so it's difficult to get a whole comprehensive picture. But I think what we want to kind of assure ourselves on is that there are really specific and targeted piece of work that we're doing as a system to tackle child poverty in D&G. So happy to take any questions and answer them as best as I can. I'm probably not quite as good as Darren would be, who's been fantastic in pulling together this report in collaboration with other colleagues.
Thank you, Val. Do we have any questions or any comments? I don't see any hands. We did discuss this at the NHS board on Monday and supported the revised action plan for 2024-26. I think Val's right. The focus on employment and some of that wider preventative stuff is absolutely critical. And the NHS will do everything we can in that space because we don't want to see a further decline in our child poverty statistics in Dumfries and Galloway. So having said all of that, and without Darren here, there may be an opportunity to feedback any particular comments to Darren and to Val out with this meeting. We're being asked to note the progress and the planned future activity and to provide feedback. So please do take the opportunity to provide feedback if you have an opportunity to do that in the next wee while. So we have now reached the end of the meeting. We're pretty ahead of time. Thank you all very much for your attendance and contributions. I hope you have a good festive period, although it feels like it's a bit of a distance away, and look forward to seeing you in 2025 and probably for our first workshop in March. Thank you very much, everybody.